Our scoliosis treatment approach. When discussing treatment for scoliosis, I like to talk about scoliosis treatments in really two main approaches. And these two main approaches are for patients to choose between are something that I call traditional approaches versus conservative approaches. One approach offers a very different potential outcome than the other. Traditional treatment options or approaches typically involve a lot of watching and waiting and tends to funnel patients as they worsen towards spinal fusion, where more conservative approaches can have a different type of approach or outcome. Spinal fusion involves a surgical approach to treating scoliosis, and it involves fusing the spine together. Now, we know your spine is designed to move. Its number one function, one of the number one functions, is movement and flexibility of the body. Well, when you fuse the spine, we actually are removing all function in that area to try to improve the alignment. So I call this a non-functional approach because that's the very definition of fusion to the spine is what it does. It's removing one of the main functions. Spinal fusion typically involves fusing the most tilted vertebra on the top to the most tilted vertebra to the bottom of the curve and eliminating all movement. Now, normally the curve is reduced in this stage, and normally rods and screws are normally attached to the spine using pedicle screws to hold it in place. The hardware is permanently attached, and then bone grafts are used in between all the vertebrae to help fuse the spine into, as the bone grafts heal, the spine fuses into one solid bone. Spinal fusion, we know it's costly, it's invasive, it can lead to, there's a risky procedure because it affects the entire spine's natural movement and function. It can lead to reduced spinal flexibility and range of motion, and we're really unsure about complications long-term associated with surgery, meaning 30, 40, 50 years post-surgery. There's not a lot of data regarding what happens at that point. Where conservative treatment options, the goal here is really to try to reduce curves when they're initially diagnosed. So it's a more proactive approach, meaning we want to treat curves when they're smaller to prevent them from becoming more severe. Now, the main reason why surgery is we wait for surgery to do when the curves are more severe because surgery is so invasive, meaning we're not going to do scoliosis surgery on a small curve because the risk of surgery is greater than the scoliosis at that stage. So therefore, they say, since this treatment is so invasive, we have to wait for this to worsen to where it starts to outweigh the risk of the surgery. Well, conservative treatment approach that don't have this high risk associated with it can be done in a much earlier size curve because we're not altering the spine in a negative way that's going to impact patients for the rest of their life. We're working on strengthening the spine and retaining normal function. I mean, we want to reduce the curve, but while maintaining function, not reducing it by fusing it. We normally offer multiple treatment options here to help reduce the curve in one office. What I find happens when patients are looking for conservative treatment options, they normally have to go to many different doctors and many different therapists. They maybe go to an orthopedist, maybe they go to an orthotist for a brace, they go to a chiropractor for some chiropractic adjustments, they go to a physical therapy for some physical therapy, they go to an exercise physiologist for some exercise, for some home therapy and home rehab. And all this stuff is being done by each of those physicians, and nobody's communicating so everything works together. And I call this very fragmented. By unfragmenting all of these approaches in one office, so therefore a patient is getting a coordinated treatment approach and all those things that we mentioned, we find that outcome can not only be superior, but it can be more efficient, and the patient is doing a more precise program to get better results. The treatment options we offer are very specifically designed to help affect the structure of the spine, because the bottom line is that most therapy, rehab, chiropractic exercises, this type of conservative approaches are normally done to help treat people that have had injuries. They're injury rehabilitation. And injury rehabilitation is normally done very slow over a very long period of time because you're trying to help people, you're assisting people in the initial acute injury as a result of what happened at that moment. Well, we know scoliosis is a structural problem that's been normally developing for years, and trying to treat it like an injury doesn't produce the same results. So therefore, we have to address the curve structurally. And addressing it structurally means that we have to address it in a different type of approach. We use chiropractic techniques, manual therapies, and rehabilitation can help move the spine, or reposition the spine into a more aligned position, but it has to be done with a structural focus. And as the curve is reducing, the goal is to reduce the uneven forces to the body, so therefore they have a less effect and they're less likely to progress. Once you reduce curves, you reduce the risk of progression, because smaller curves reduce slower than more severe curves and also have a less risk of progression than more severe curves. Therapy is a very important part, but the therapy needs to be structurally based, meaning it's not just about increasing range of motion or improving flexibility or just about balancing muscle tension. The idea here is the physical therapy is a structural rehabilitation to help reduce the curve at a structural level. So the therapy is an asymmetrical approach that helps restore normal alignment. With this type of therapy or physical therapy that we use, we also can use scoliosis specific exercises to help increase the strength associated in maintaining that reduction in the scoliosis. Most general exercises, like exercise physiology or back pain or back strengthening or normally just core strengthening exercises. And even though we do recommend core strengthening, scoliosis is not occurring because somebody has a weak core. In fact, my average patient who's an adolescent is normally an avid dancer or gymnast that's a female, and normally they're very strong. They don't have weak cores. That's not the problem. The problem is that they're not being treated properly to help reduce the scoliosis. They're very strong, but they're globally strong. They're not managing the strength appropriately to help asymmetrically train the spine into a straighter position. Not only can the therapy be used to help structurally change the spine, but it can help lengthen the tissues that have gotten taut and tight as a result of reacting to the scoliosis, and tighten some of the tissues that have lengthened as a result of them reacting to the scoliosis. This is structural rehabilitation as opposed to just general therapy or general exercise. Lastly is neuromuscular education, or therapy that's involving the brain-body relationship. As patients develop scoliosis, they lose something we call proprioception because they have a curve in their spine and they're normally not symmetrical. They have to kind of retrain their body into what's considered straight. You ask them to stand up straight, they're standing with a curve, their shoulders are untilted, the waist is completely flat, they're translated one way or the other, and they think they're standing straight. So therefore, they have to be trained, and not only as we reduce the curves, but how to maintain this normal position. In addition, we can also add very specific corrective bracing to the program. And the corrective bracing is designed to help us reduce the curve and augment everything we just mentioned. What corrective bracing can provide is a very strong body molding. So even though we can reduce the curves, improve the flexibility of the spine, structurally address the curvature, a lot of times we need to change the shape and mold tissues and ribs into a more aligned position. A very well-designed corrective brace can push on the different areas of the body to help get the body to react into a better position while we're actually changing the shape of the spine. And the last thing is taking everything I just mentioned, and developing a home rehabilitation program, whereas there is a series of customized exercises that are taken from what's effective in the treatment program for them to establish home rehabilitation to further stabilize the spine with their home corrective brace. This type of program that's very unique and comprehensive to the patient, what can provide the ultimate results in reducing the scoliosis and actually getting a curve to actually become smaller, not just managing the effects of the scoliosis, not just treating the symptoms associated with scoliosis, but actually reducing the curve itself. Reducing the curve on a structural level is the difference between treating somebody with scoliosis and treating somebody's scoliosis. We definitely recommend being proactive, meaning treating curves the minute you diagnose them, because we know across the board, smaller curves respond better than severe curves, younger patients respond better than older patients. So the sooner we treat scoliosis, the better results we have at getting results with our conservative approach. Here at the center, we not only work on preventing progression, but we definitely integrate multiple scoliosis condition-specific treatment programs, and they're very customized, meaning there's really no two programs that are exactly the same, because every curve is very different, and how that person presents themselves and how they respond to the care is also very different. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.